so whoever is waiting, I can take them right over here. Whoever is waiting next, I can help you right over here. If we haven't helped you yet, please come right over to me. Please come right over to me. Thank you. Thank you. Alrighty, well, are you who's next? Okay. So we haven't checked you in for your appointment yet, right? Okay, alright, so you are my next patient. Amazing. Alright, so what we're going to do is I have some paperwork here with a bunch of different questions on it, and I'm going to ask you those questions, and then I will record your answers on this clipboard that our office uses, okay? Perfect. Alright, so if it's okay with you, we're going to get started. Amazing. Alrighty, well, we try to keep this office as calm and quiet as we can to encourage relaxation with all of our patients. So I will go through these questions at your pace and allow you to answer them in a stress-free environment. If there's any question you don't know the answer to, that's absolutely okay. We will do our best to discover answers about your history. We just ask you to be as honest as you can, okay? Perfect. So I'm going to go ahead and get started, alright? Alright, so let's just start off with some easy basics for you, if that's okay. So you are here for our 1:30 appointment. 1:30. Alright, and what appointment type did you book? Alrighty, a basic checkup, perfect, okay. And what I'm going to do is, if you can confirm the phone number that you booked the appointment under. The phone number, yes, the phone number that you booked the appointment with. Okay. And okay, perfect. Thank you so much for that. That does match what I have, so we're good there. And then can you also please spell out your full first name for me? So that would be your full first name. Let's see. Alright, perfect. And do you have a middle initial? L, okay. And what is your last name fully spelled out for me? Your last name fully spelled out. Amazing. That's perfect. Thank you so much. So you so far just gave me your full first name, your middle initial, and then your last name. Do you have a preferred first name that you go by? Yes, a preferred first name that you go by. If you can spell that out for me. Okay, perfect. Thank you so much for that. All right, so perfect there. I'm going to complete some additional basic personal information next. Can I please ask you what your email address is, your preferred email address contact? I don't suggest it being a work email, but something you have readily available, perhaps on your phone, would be a great email contact. We will send some appointment reminders to that email. We might also send you some record alerts or some result alerts as well. Perfect. So I'm going to have you fully spell that out for me. Okay, at .com. Perfect. All right, that is your email and your preferred name. And then can I please have your home address, and is your billing address different than your home residential address? It is not. So they are the same. Perfect. Alright, so what is that address? Please, if you can, include the house number, or street name if you have a unit or apartment number, and as well as including the city, the state, and the zip code, please. So the number. Okay, perfect. And then what is the street number or the street name? Okay. Is that 2 words? It is. Alright, and perfect. Alright, so that's the number. And is that road, street, avenue, circle? Okay. Alright. Perfect. And is there a unit or apartment number for your address? No. Okay. Is this a shared residence? Perfect. Okay. Got it. And then what is the city and state? And then please also remember to include the zip code. All right. Okay. So that's and in state, the same state. Okay. All right. Thank you so much. And the zip code. 4, 5. Okay. Perfect. So I think I have some really good basic information here. Is there anything you've given me so far I need to amend? All right. And the cell phone number that you gave me earlier, can we text you confirmations for appointments at that number? We can. Amazing. Okay. So I think I've got some really good basics here for your information. I'm also going to ask you for your date of birth. We will include that on a couple of different forms. So this is the last thing I need just for this one, okay? Your date of birth, the month, the day, and the year, yes. The month, okay. The day and the year. Okay, perfect. I'll just mark a couple things. Okay. Perfect. So what I'm going to have you do is once we fill out all of these forms, I will just have you sign on each of them to verify that all of the intake information is correct, okay? Perfect. All right, and let me see. I've got... Okay, perfect. So, we just have 2 more to go. Won't take too long, I don't think. So what I'm going to do next is do some basic medical history for this form. This will include, again, things like your date of birth. Will also include known allergies, any surgeries that you've had in the past, any intense medical operations, things like height, weight, that sort of thing. Okay. Perfect. So, can I have you give me your full first and then last name again? No, I don't need the middle initial for this one. Thank you for asking, though. Okay, and last name. Perfect. Okay. That's amazing there. And then I'm gonna have you give me your date of birth again. Okay. The month and the year. Okay. And just to check, you are over 18, so you do act as your own medical representative. Is that correct? You do not have a guardian who speaks for you. Okay. Perfect. You're doing really good so far. I just want to tell you, you're doing a great job. I know going to a new office can be a little overwhelming and stressful, but you're doing amazing. So thank you so much for your patience. Perfect. So now I'm going to start into some medical history. So first, can you give me your approximate height? And if you can also give me your approximate weight. We will take measurements today, but we want to start off with something before we start your appointment, all right? Okay. Perfect. And do you know your approximate height? In feet and inches, yes. Okay. And then do you know your approximate height? Inches, perfect. And do you have an estimate on your weight? Your current? If you're not exactly sure, that's absolutely okay. We just ask you to take an educated guess. Again, we will get some concrete measurements today, okay? In pounds. Perfect. All right. Thank you so much for that. And when was the last time you got both of those checked by a doctor? Okay. Perfect. And do you have any known allergies? Either ingested allergies, for example, you ate a food with nuts in it, or a topical allergy. For example, a cream you've been using in the past has given you a reaction on your skin, yes, like a topical ointment for injuries, or maybe moisturizer, something skincare related. So for topical, you don't have any known. Okay. And then what about ingested? Yeah, like medications or food allergies. So you're allergic, okay. To shellfish? Okay. Alright, and is that a known allergy? It is. Do you have any other known food allergies? Okay. Perfect. And have you ever been allergy tested? Sure. So that's usually where they will draw that grid on your back and put different items on your skin to test to see if you have a reaction to any of them. No. Okay, perfect. And are you allergic to any medicines? Penicillin, okay. Do you have any other known allergies for Okay. And how did you find out about that allergy? You had a reaction as a kid? Okay. Okay, perfect. And do you have any medical history of any major surgeries, operations? Also, anytime you've been under general anesthesia? Yeah, so general anesthesia is when you would have been unconscious for the operation, versus localized anesthesia would be localized numbing for an injury where you are not unconscious for so much as that area was numbed. Both? Okay. For the general anesthesia, what was the surgery? You had your wisdom teeth taken out? Wisdom. Okay, and did you have any bad reaction to the anesthesia? No reactions at all? Okay. That's good to hear. Okay. With the wisdom teeth surgery, just to be specific, when did that occur? Of last year? Okay. Perfect. How many wisdom teeth? Did you have all of them? You had 2 wisdom teeth too? And did that occur at an oral surgeon's office? It did, okay. So you were unconscious for the operation? Okay. Okay, perfect. And have you had any other general anesthesia? You're not sure? Okay. What was a time where you weren't sure? Oh, you broke your arm when you were young? Okay. About how old were you when that happened? Okay. All right. And you don't remember? That's fair. That was quite a while ago, so I understand. Perfect. All right. And is there any major concern in your medical history with your family as relating to heart conditions, diabetes, cancer, anything of that nature? No concerns. I love that. And that would be for your siblings, your parents, and grandparents. All right, perfect. That form looks, it's all done, so it's time to go to the next one. All right, thank you for your patience there. And we are on the last form, which thankfully the last form is the fastest one today. So I'm going to have you give me your full first and last name again. All right, perfect. Yeah, you're doing great. And the last name? Amazing. Well, that matches. And your date of birth again, please. Okay, thank you so much there. So this last form is for today's appointment. We're just looking to get from you what brought you in today to make sure that we are doing the correct diagnostics and checks for you today, all right? Perfect. So what is the appointment that you booked for us today? What are the concerns that brought you in? Anything you feel comfortable sharing with me? Okay. All right. So today you're looking for like an annual checkup? Okay. Are there any specific concerns that you have? Okay. And are you looking to get blood work done today as well, just to run a panel for you? Perfect, okay. Have you had your blood work ran before? You have, okay. Have you had any concerns getting your blood drawn before? Some individuals get very lightheaded, they pass out. You have not? Okay. Alright, we should be all good there. And as I think you said earlier, it's been about a year since you've done that? Okay. And previously you went to a different doctor's office. Okay. Just to confirm, this is the first time you are visiting us here, right? Okay. And what made you change your doctor's office? Oh, you moved? Oh, nice. From in-state? Okay. When did you move to the area? Oh, 6 months ago. Okay, nice. Alright, perfect. While I have you with me, we are doing your annual exam today. Do you need to schedule any other appointments with us today? Not right now. Perfect. Alright, well, all of this looks great. I just have so I'm going to take all of this information and I'm going to input it into our system. I'm going to draft a full document of everything that we talked about today. And then while you are waiting for the doctor to be ready, I'm going to come back over and just have you read through everything and make sure that it is correct. Okay? Perfect. And then you'll sign off on it. Alright, well, you have been so patient with me today. Thank you so much for answering all of these questions. I'm going to let you get back to reading the book you brought with you, and I'll come back to you in a few minutes, alright? Of course, thank you. In room 2, and then I'll head over, okay? Perfect. Of course, thank you so much. Yep, bye. Hi there. It's nice to meet you. Of course, I will be taking care of you. My name is Kate. I am one of our registered nurses here. So what I'm gonna do is take all of your key vital information, and when the doctor is ready, they will come in after me, okay? Of course. So you already checked in and filled out the form at the front desk? Perfect. Okay. I'm just gonna confirm a little bit of additional information, alright? Can you confirm your first and last name for me, please? And your date of birth. Thank you. Perfect. And then can you confirm your phone number too? Amazing. And then you are here just for like an annual checkup, correct? No major concerns. Okay. And a couple other questions that we did not ask you at check-in. We do not ask them in a more public setting is, are you a smoker? No. Lovely. And do you use any nicotine products? Nope. Okay. Vapes? No. Okay. Perfect. And do you wear glasses? Okay. What about contacts? Okay. Have you ever been prescribed either of those? No. Okay. Okay. And then is anyone in your immediate family, so that would be siblings, parents, grandparents, do they have any major health concerns or issues, any major diagnoses that we should know of? High blood pressure. Okay. And which side? Paternal or maternal? Okay. Perfect. Appreciate that. And to confirm, you have never been to our office, is that correct? Perfect. Well, welcome. We are very happy to have you here. We hope that this appointment is very peaceful and relaxing for you, and hopefully it encourages you to come back on a future visit here. Absolutely. Perfect. All right, and all right, so just gonna leave that there so I can take notes throughout your appointment. So what I'm going to start off with is just a light visual inspection of some of the features of your face, and then I'll probably just do again some basic vitals. If there's any questions you have, please let me know and I'm happy to answer them. I can slow down for you, whatever would work best for you. Okay, so first I'm just going to do a quick, again, just visual check. If you can just stay still for me. Perfect. I'm just gonna do a quick. Alright, everything looks pretty usual there. And I don't see anything super concerning. Okay, perfect. Alright. So good. So far, so good. Yes. So how's your day going so far today? That's very good to hear. I love that. Alright, so first I'm just going to do some hand sanitizer before I grab my gloves. Alright. Yeah, it's pretty efficient hand sanitizer for sure. Okay. Alrighty. Next, I'm just gonna get some gloves on. Just do a quick visual inspection of the gloves. Make sure they are quality gloves. Perfect. All right. All right. So first, I'm just going to take a couple of key vitals. I'm going to grab your blood pressure, your heart rate, and then I'm also going to take your temperature. They already grabbed your height and weight before coming here, right? Perfect. Okay, excellent. So we're going to start off with those few vitals, then we'll go into a little more detail, okay? Good, okay. So I am going to do blood pressure first. So what I'm going to ask you to do is if you can choose your left or your right arm, whichever you feel more comfortable with. I am going to apply the blood pressure cuff that had that Velcro cuff on your arm that applies some air to inflate it. It does have to go relatively high up to your arm, so if you can move your sleeve up about as high as you can make it, I can help as well. I would really appreciate it. It can be a little bit uncomfortable, so I do apologize for that in advance. Do you want to do left or right? Okay. Alright, go ahead and roll that sleeve up. Grab my stethoscope so I can hear. Alright. Let me just loosen this a touch. Alright, and I'm just going to fasten this around your arm, okay? Like I said, it can be a little bit uncomfortable. Alright, and I'm going to inflate that just a hair, okay? While we are doing this, what I'm going to have you do for me, I just need you to make sure you keep your legs uncrossed and then your feet flat on the floor or as close as you can. You can rest your feet on that step that's right there, kind of like a footrest. Alright, this is going to start to get a little bit tighter. I'm going to have you hold still for me. Okay. And I'm going to do the last couple pumps, and this is where it gets really tight. Alright, just keep those legs uncrossed for me. Just remember to continue breathing. Just going to check your blood pressure. Perfect. Thank you so much for that. We're just going to let that air out. Perfect. I'm just going to slide that off your arm. Such a good job. Yeah, no major concerns from me with your blood pressure, but your doctor will be able to give you more information, okay? Alright, so next I'm going to just check your heart and your breathing with my stethoscope again. You are good to unroll the sleeve. Thank you so much. So what I'm going to do next is to listen to your heart a little bit. I'm going to listen to it from the front as well as the back. I just want to confirm I am okay touching those areas. Perfect, thank you for that consent. So what I am going to do is to place this stethoscope onto those areas, again on your chest and your upper back. I will let you know when I'm also going to be listening to your lungs. During that time, I will instruct you to take specific timed breaths, okay? But we're going to start with the heart first. So if, again, you can stay as calm for me as possible, just sit back, relax, and don't forget to breathe, okay? Alright, so I am going to start off with your chest. So I am going to reach into your shirt so this can make contact with your skin, okay? Alright, so I'm just going to reach under your shirt. Okay, and I'm just gonna have you stay quiet for a moment. Again, don't forget to breathe. side. Again, don't forget to breathe. Alrighty, felt okay. Alright, I'm going to reach into the back now, okay? I'm just going to reach around you. And again, this is under your shirt, against your skin. Alright, and the other side next. Again, into your shirt and against your skin. Perfect. Okay. So now I just want to listen to you breathing, okay? So I'm going to again reach this into your shirt. I'm going to focus more so on the middle portions of your chest, okay? Yeah, so I'm going to reach into your shirt again. Alright, I want you to take a couple of deep breaths for me. Ready? In. Hold it and out. Good. Alright, other side. I'm gonna reach into your shirt and breathe in. And out. Perfect. Perfect. Alright, good. Okay. Now I want you to do just standard breathing in through your nose and out through your mouth. I'm going to use this on your back now, under your shirt, against your skin. Of course. Alright, so in your shirt and just 2 regular breaths, okay? So good, okay. Now the other side in your shirt. And just regular breaths in through your nose and out through your mouth. Okay. Perfect. Thank you for that so much. Yeah, you did a really, really good job. Alright, so next I'm going to take your temperature, okay? Yes, this is freshly sanitized. Alright, so I am just gonna have you kind of lift your tongue up a little bit. This is going to go under your tongue. Yeah. Alright, so I'm gonna just. Alright. Let me just check. Okay. And I'm gonna have you close your mouth. Good. Alright, now I need you to just stay still for me for at least 10 seconds. Try not to move the thermometer, okay? Alright. And when it beeps, it means it's done. Oh, there we go. Alright, lovely. That's pretty healthy. Yes, very normal. Alright, you are doing so good for me. Next, I'm going to do a quick nasal swab, okay? Yes, just to make sure we don't see anything suspicious in any of your red or white blood cell counts. Yeah, no infections that are hiding in there. Alright, so just gonna have you hold still for me. This can be a little uncomfortable, okay? Yes, I'm just gonna lightly place it up your nose, not too far. Alright, so just hold still for me. And I'm just gonna rotate this a little in each nostril, okay? And good. Perfect, okay. Excellent, alright. I do that, I am just going to put this paper covering on your upper chest, okay? Okay. Alright. Alright, just hold still for me. Okay, perfect. Okay, so I'm just gonna have you again hold still for me. I'm gonna have you just slightly put your tongue out for me, okay? I am going to move this around your mouth just a little bit, alright? Yeah, just a quick visual inspection, nothing too intense. Okay, perfect. Nothing concerning so far. Now I'm just gonna check with this light that I have here, okay? Yeah, okay. So, just again, be just calm, and if I make you feel uncomfortable, I do apologize. Unfortunately, it can feel a little bit awkward. Now I'm gonna have you stick your tongue toward the roof of your mouth. Alright, perfect, thank you. I'm just gonna, again, do a quick check with the light. Alright, that looks pretty good. Yeah. Alright, no major concerns there, so awesome. Next, I'm just going to take a couple quick measurements of your face, okay? Yeah. We just want to make sure that everything is proportionate and such. So, just I will do what I need to here. You don't have to move at all. Alright, perfect. Goes down. And good. Okay. Okay. Next, I'm just going to do an ear inspection, okay? Just change these. Perfect. Alright, just kind of hold still for me, okay? Yep. Alright, your ear over here. Looks good. Yeah, no issues with your hearing at all. Okay. Okay. Good, and that side. Okay. Looks perfect. Yeah. Alrighty, you have done such a good job. Yes, you did perfect. So, I'm just gonna add a couple of notes here. But I am all done, so I'm actually gonna have you hang out in the room for me. Probably won't be more than just a few minutes, and sorry about that wait. You have been waiting to see a doctor, is that correct? Perfect. All right, well, that is me. My name is Dr. K. It is very nice to meet you. Of course. All right, well, let me review. I took a look at the chart we started for you today. Thank you for being so patient with all of our questions that we ask during the check-in. We want to be as thorough as possible, as I'm sure you can imagine. So let me take a look. Okay. And you have no known allergies. Okay. And just to confirm, what is your first, last name, and birth date? Perfect. All right, well. All right. Let me just review the notes from the nurse that was here before me. Okay. So, we did your blood pressure, okay, and then your heart and your breathing. And you said you do not wear glasses? Okay. Contacts, no, okay. When was the last time that you went to get your eyes checked? You haven't? Okay. I am a kind of family medicine doctor, a general practitioner, so I am not an expert in all things eyes, but I can just take a quick look at them today just to make sure there's no concerning spots or anything like that, okay? And you don't wear glasses or contacts? Okay. When was the last time that you at least went to go get your eyes checked by an eye doctor? You haven't? Okay. No major concerns. Well, I am not an expert in eyes. I am more of a family medicine general practitioner, but I can take a look at your pupils today just to make sure there's nothing super concerning for you. Okay. And I saw that you are a non-smoker and you're just a casual drinker. Perfect. And coffee consumption also. All right, so that sounds good. I did check that sample we took earlier of inside of your nose. The screen came back with nothing of major concern, no infections. It appeared that your blood and white cell counts were normal range, normal. Yes, of course. So you're good there. Okay, and when was the last time that you saw a dermatologist? Yeah, well, we like to ask that question, especially in the summer. You spend a lot of time outside in the sun, so we get a lot of folks just concerned about just spots that are concerning on their skin. Make sure that they're just freckles and nothing more. Okay. We do have a dermatologist who works out of our office a couple days every other week, so if that was something you wanted to do, we can definitely set that up for you today. Okay, perfect. All right, well, just gonna do a couple of quick spot checks myself, and we'll just do a quick eye exam like I mentioned, okay? Just a very standard one, nothing specialized. Gloves. Okay. How are you doing today? That's good to hear. I am doing all right. Thank you for asking. Of course. Well, I'm glad to hear that this appointment's been going really well for you. Again, you've been so patient, so thank you so much for that. We really do appreciate it here in this office. We know sometimes going to the doctor is not the most fun experience, so anything we can do to just relieve a little bit of stress, we are happy to do, of course. All right, so just going to start off with that eye exam, okay? Alrighty, so this is my card. So first I'm just going to do a quick inspection of your eyes. If you can do me a favor and close one eye and open the other. Perfect, yeah. This pen here kind of shows me a gauge for the pupil, like how dilated it is. You've probably never had your pupils dilated if you've never been to the optometrist, the eye doctor. Alright, so choose one eye to open and one eye to close, and I'm going to have you keep them that way until I have you switch it, okay? Alright, so I'm going to keep the light steady. So let me just, okay, good. Now switch eyes. Okay. Very good. Perfect. Now what I'm going to do is flash the light a few times in each eye separately. If you can, please just keep them both open for a few moments and then I'll let you blink, okay? Of course. Alright, so. Alright, go ahead and blink. Good, I'm going to do that again. Okay, perfect. So what I want you to do is I'm going to shine the light, both eyes open. I want you to follow the light with your eyes, keeping your head as still as you can, all right? Yeah, I'm going to start with left to right motions first. So we're going to start in the center and kind of work our way. Good. I know sometimes when it's farther to the side, it can be harder to keep our head straight. Perfect. So I'm going to do the same thing but up and down, okay? Alright. Perfect. You're doing so good. Now I'm going to do a diagonal pattern. Yeah. Good. Okay. Perfect. Any other way? Top to bottom. Okay. Now I'm going to shine this light specifically in one of your eyes. I just want you to tell me which one it is, okay? Alright, so. Perfect. And this one? Alright, and one more? Perfect. Alright, so now I'm just going to do a quick sight check. I'm going to have you start off with the first letter that you see. Good job. Alright, and then I'm going to have you do the second row now. It's this one. Perfect. Okay, and then the next row. Very good. And I'm going to have you actually jump down to this row since you're doing so good so far. Perfect. And then if you can do this row, amazing. And then can you do the last row for me? Perfect. Yeah, looks pretty good. I don't see anything concerning in your eyes. We do definitely suggest still seeing an optometrist though to make sure that there's nothing they see that's of concern. Of course, yeah. Alright. Just add that note. Alright, perfect. So one other thing I'd like to do is a reflex check, if that's okay. Yeah, and just a quick hearing check too, just to make sure everything looks correct for you. Okay. Alright. I'm going go ahead and do those reflexes first. So I want you to just, if you can, just kind of let your legs hang loose and no crossing them. All right, perfect. So I'm going to just lightly hit them with this hammer. I promise it will not really hurt. Your instinct might be to kick your leg out a little bit. That's your reflex. It's kind of what we're looking for here, okay? Alright, so I'm going to go ahead and... Perfect. Alright, I'm going to do the other one. Good. Alright, I'm going to hit a different spot this time. You're doing so good so far. Good. Alright, and then this spot. Amazing. Alright, I'm going to go a little lower. Good. And once more. Alright, perfect. Excellent. Now I'm going to have you kind of loosen your arms for me if you can. Alright, I'm going to hit this side first. Perfect. Alright. I'm going to do this side next. Good. Alright, I'm going to do that side again. Good. And excellent. Okay. So next I'm going to do a little bit of a hearing test. This is also something that just kind of helps to check on your cranial nerve as well. In your brain. Alright, so what I want you to do is close your eyes for me, and I want you to tell me which side you hear the sound coming from. Yes, which ear. Alright, so, ready? Good, alright, I'm going to do this test again, okay? Ready? Okay, I'm going to do it again, and I want you to tell me which side. Okay, perfect. So what I'm going to do now is I want you to tell me if it's further or closer to your ear. Yes, where you hear the sound coming from. Is it closer or further from your face? Okay, ready? Correct, that's closer. That's further, closer, closer, perfect. All right, the other side now. Further. Yes, that's closer. And further. Closer, perfect, so good. Now I'm going to do this in front of your face, and I want you to tell me if it's coming from which side, okay? And that side, perfect, okay? Alright, well, I see no major concerns from you. I think you are doing amazing. So I am going to send you up to checkout, and they can schedule an appointment. And if you'd like to do that consultation with a dermatologist, you can, okay? Absolutely. Have the best day ever. Bye.